If I would ask you the question, so you have the Nutritional Detox and you have the Eliquis, we say both may have contributed. If you were given the choice of one versus the other, you can only have one or the other, which one do you choose to treat this patient? Well, welcome to another session of Montgomery Heart Wellness Clinical Rounds. Today, Camille and I will be discussing a young man with chest pain and palpitations. So what do we have?
We had a 23-year-old man who came to the office because for a few months he was having this sudden occurrence of chest tightness, a little lightheadedness and dizziness, and racing heart. This was occurring about once to twice a month. And he would just be sitting or eating. He wouldn't be working out or exerting himself. And so because it hadn't gone away, he wanted to get a cardiac evaluation and make sure it was nothing serious. He overall appeared healthy, had a great blood pressure. He was a normal body weight, moderately athletic looking build. He worked out. He ate a typical type of diet. He would cook bacon and eggs, quesadillas. He did eat some vegetables.
Do you remember the baseline blood pressure and heart rate?
I don't remember, but they were truly normal.
The heart rate wasn't like 80s or 90s, was it?
I believe it was
60s,
in the 70s.
70s, okay.
Later on, we found some testing that kind of highlighted that. But
okay.
And he wasn't a smoker. He didn't drink alcohol excessively. I was trying to think, okay, well, what would be causing the symptoms in this young individual? And so, of course, we ordered very comprehensive testing, and a lot of that looked very great, but some things were markedly abnormal, especially for his age. What was normal was his treadmill stress test was good, and he exercised for a good period of time. He didn't get symptoms with exercise either. His blood work overall was actually good as well, except one marker. His inflammatory marker, the high sensitivity C-reactive protein, was really high. It was 7.7, and normal is less than 1.
So we have a young man coming in with symptoms of chest pain, sensation of heart racing, and some shortness of breath. You know, the differential diagnosis of chest pain in the generic sense is it cardiac, is it GI, is it pulmonary? Also neuromuscular. Some people can have chest pain when you have like a pinched nerve. It can have referred pain to the chest area. GI could be anywhere from, reflux or GERD or gallbladder disease can cause chest pain. So there's a broad spectrum of things that can cause chest pain, so then you have to narrow it down. A young man, 23 years old, is he too young to have coronary disease? Not too young to have coronary disease. You can't have coronary disease at that age. You can have heart disease at that age. So his age doesn't exclude him from heart disease in general. But now you're dealing with, palpitations, shortness of breath, sudden onset. Could there be some lung problems? So, we were thinking with the high inflammatory markers, the echo was done also.
Yeah, his echocardiogram showed his heart was pumping at 50%, where normal is more 55 to 65%. Maybe in a 70-year-old individual, 50% would be more acceptable, but for him being 23, that was lower than we tend to see or want. His heart also wasn't filling up appropriately, so he had some diastolic dysfunction, something that we primarily see very commonly in people over the age of 50. Not a lot of 20-year-old patients unless something is stirring. His right ventricular systolic pressure was high. It was 41. That age with no known lung history be less than 25, 20. And that was alarming. That really made me think more, okay, could there be a pulmonary embolism? Could there just be inflammation affecting the heart and increasing that pressure in the right side of the heart? But that really prompted us to eventually order more testing.
He did have a history of being vaccinated. We know that that's important in this young man's age group because if he has heart disease, these individuals can have myocarditis. We've been seeing individuals his age come in with myocarditis, so that's one consideration, especially with palpitations and chest pain and shortness of breath. Those are symptoms of myocarditis. You also mentioned the possibility of a pulmonary embolism, that's blood clots to the lung. those symptoms can also occur with someone with blood clots to the lung. So if you have increased pressure on the right side, if blood clots go into the lung, it clogs up the flow of blood through the lungs with clotting in those what we call pulmonary arteries. And so flow through the right side of the lung is impaired, so the pressure goes up because there's more resistance due to the clotting in the lung. In the case where if it's due to the left heart being either stiff or weak or both, then that's congestion backed up from the left side of the heart. He has two suspicious possibilities. The echo shows the left heart not being quite normal, it's stiff, is with the diastolic dysfunction. And the ejection fraction, even though it's normal, it's sort of borderline normal. So then that implies that could be contributing to increased pressure on the right side itself. So which is which, or is it both? And so how do we differentiate that? So, and what I want to share with you is that there's a thought process. We're coming up with a differential of it's the left side of his heart, the left ventricle that's congested, causing the right side pressure to be up, or is it blood clot, or is it both? So now we have to say, okay, this is what our thinking is. Now we order tests based on our thinking.
First, I actually did extra additional blood work, just checking some other general screening inflammatory markers. So an ANA, a SED rate, make sure there maybe wasn't something more autoimmune brewing. And his cardiac enzymes were normal, actually.
Including the troponin, which is the ultra-sensitive troponin.
Right.
Okay.
And the BNP was normal. If those markers are elevated, that means more inflammation in the heart. That we can see in myocarditis. You could see in fluid around the heart. You can see in a heart attack, heart failure. It's not specific to only one thing. It was somewhat reassuring they were normal in terms of how urgently did we need to go about this. The fact that his symptoms were intermittent a few times a month also affected that thought process as well.
And I like to think with the BNP and troponin, you're right, inflammation can cause those numbers to go up, and anything causing stress on the heart, whether it's increased pressure or whatever the case is, you're right, could cause those numbers to go up. So the fact that they were normal was quite telling in the sense that, well, the heart muscle cells don't appear to be under so much stress, so we're not getting signals of that. Can't totally rule it out, but it certainly points in the opposite direction.
And we also did a heart monitor because of the racing heart, and arrhythmias can cause the symptoms he was having. And his heart monitor actually looked great. His average heart rate was 77. Often in major blood clots, patients' resting heart rates are higher.
And that's a great point you raised. So sometimes symptoms of chest discomfort, shortness of breath could be primarily due to an abnormal heart rhythm. And I've seen a lot of patients come in an abnormal heart rhythm. The heart may be in an abnormal rhythm, whether it's what we call SVT or atrial fibrillation, and the rate goes up to 200 beats a minute. And they may not always feel the heart racing, but they'll feel chest pain and shortness of breath. But on the monitor, you're seeing heartbeat 220 beats a minute and some arrhythmia. And so the arrhythmia itself will manifest as those symptoms, not just as a racing heart. Now, he had all three, but that's something to think about. So, but we didn't see that, so.
Correct. So we decided first to give him the opportunity to change his diet because he truly didn't eat healthy. So he was about 50 to 70% compliant on a plant diet. So when he came back, he had a little less symptoms. His inflammatory marker, that C-reactive protein, had gone down from 7.7 to 3.6, but his echocardiogram actually looked a little bit worse. And so his pumping of the heart was more like 45 to 50%, and now the left ventricle wasn't contracting symmetrically. So at this point, with the right ventricular pressure staying the same, still high, we decided to order a little more advanced test, a cardiac MRI to check for scarring and other signs of inflammation and myocarditis, and a CT scan of the lungs to check for pulmonary embolism, and a chest x-ray as well.
There was a variation that certainly was an improvement. The EF was there was some overlap, 45 to 50 versus 50. It's either the same or slightly worse on the other echo, which did raise some concerns of, wait a minute, is this truly worse or is it truly the same?
And I think it's good to be thorough and order those extra tests when we're not 100% sure what might be going on. But his MRI actually looked very good. No signs of myocarditis, and his CT scan of the lungs didn't show any blood clots down to the segmental level, but the CT scan cannot pick up blood clots in the smaller vasculature. So we had a discussion about that, and his chest x-ray of the lungs didn't show any signs of inflammation in the lungs that could be due to like asthma, prior infection. So we just wanted to make sure there was nothing else causing that right ventricular pressure to be high. But just because of his presentation with the symptoms that are very commonly seen with blood clots, we decided let's treat him with Eliquis and see how that does. Eliquis is an anticoagulant, so a blood thinner often used to treat blood clots in the lungs, and also discuss the importance of nutrition again and how imperative that is. And he was willing to be a lot more compliant this time, knowing what our train of thought was. And the things we were discussing are very serious, so he definitely took that seriously and was much more compliant the second time around with healthy eating. So when he came back for the most recent visit, we redid his echocardiogram again, and now the heart was pumping 50 to 55%. The heart was filling up normally, and the pressure in the right side of the heart went down from 41 to 34, and his inflammatory marker had gone down significantly to 0.3, which you want it less than 1. So that was wonderful. And I think a lot of that was him being a lot more strict on his nutritional regimen. That in of itself can improve the filling of the heart. We see that all the time. And that can therefore help the right ventricular pressure. It's probably a combination of things is what my interpretation of that was, a healthy diet and potentially that Eliquis helping him out.
Is an interesting case because you can't totally exclude microemboli in the right side of the heart. And the RV systolic pressure going down was very significant. I agree with you. It's likely a combination. I think the diet played a huge role. If I were to ask you the question, so you have the nutritional detox and you have the Eliquis, we say both may have contributed. If you were given the choice of one versus the other, you can only have one or the other, which one do you choose to treat this patient?
I would probably, if they would have 100% compliance.
But this assumes 100% compliance. You got to be 100% compliant with the Eliquis too. So, because it's going to go on the effectiveness of the therapy itself. But I agree with you. They have to be 100% compliant regardless of what you give. Because you get a prescription, they don't take it.
That's true. So, I would say the plant-based detox, because his inflammatory marker went down by him being partially compliant. It almost went down by 50%, and then it dropped dramatically even more. Now, if he had presented where his oxygen was desaturating as he walked down the hall, and he was having very frequent symptoms, average heart rate 100 on his heart monitor, I would definitely want him to be on Eliquis.
You brought up the other scenario. If it's a little sicker. So if it's desaturated, a little sicker, which would you choose, one versus the other?
Yeah, well, I would choose Eliquis if he was presenting very acutely ill.
It's not a gotcha kind of question. It's one of those things where you do what you do. I would choose the nutritional detox in either case. Now, while I think the Eliquis was the right thing to do, I think the nutritional detox can help in both cases. So it's more of a universal therapy. We put our patients on raw fruits and vegetables only. There's nothing heated above, say, 130 degrees. It's hydration. We typically start them on a time-restricted eating pattern, so the first meal starts somewhere in the neighborhood of 10 a.m., last meal around 4 o'clock. They're drinking lots of water, lots of hydration. And so that's the regimen we have. So in that regimen, we've shown our publications where you see, on average, a reduction in C-reactive protein about 30% in just 4 weeks. Other inflammatory markers improve, cytokines or biomarkers improve. We've shown the case series where ejection fraction improves, blood pressure improves, etc. Heart rate goes down. All that's been scientifically validated in our publication with just the detox alone. And by the way, inflammation of itself creates a predisposition to thrombosis. So with increased inflammation, you have a setup for increased clotting. So when decreasing inflammation by itself, it's an anticoagulant effect. That's one. A plant-based diet also reduces what we call blood rheology. If your blood is like, maple syrup in the wintertime and it's very sluggish, it's going to predispose to clotting as opposed to it's, more liquidy like water. And so plant-based diet takes from maple syrup in the wintertime to more watery. So that's my bias for the raw plant-based diet. I don't argue with the Eliquis being an added benefit, but even with one, now, if he's very, very acutely ill, yeah, you give him a blood thinner. 2, you put him in the hospital. When I do those things, I'm playing more standard of care, cover your rear end and so on and so forth. But if I know they're going to do the detox 100%, I think the detox can make a big impact in a relatively short period of time. So how do you sum this case up?
Somebody who appeared healthy on the outside, we found things that were actually abnormal with lifestyle change. He was able to improve his inflammation and improve his heart health. He was really encouraged and empowered, and I think that speaks a lot too, because he noticed when he was more compliant, things got more improved. And so now he's actually enjoying learning about more of a plant-based lifestyle and understanding how important it is to prevent or treat illnesses. And I also think it kind of highlights that whether you're acutely ill or maybe mildly ill, or maybe you don't appear ill, but we find things that are off or vice versa, the healthy lifestyle changes can only help you in every aspect.
And I like the point you made about him being empowered, because being educated and empowered, that's the other therapeutic component. And he's walking away with something that, hopefully he will use for the rest of his life, to maintain optimal health. And maybe if he slips up and has these symptoms again, he'll know what to do next time.
Right.
So hopefully that was insightful, and hopefully you got a lot out of that. If you have any questions about what we discussed, leave it in the chat. We'll have our team members monitoring the questions, and we'll certainly work hard to get back with you as soon as we can. But until next time, take care.